Hey, my name is Brandon. I'm with dialysis here at Lafayette General. This is Devin. So we just kind of put together a video just to kind of show you, give you an overview of the CRT machine and a few troubleshooting, things to look for and things to fix. So I'll let Devin start, I guess.
Let's give a general introduction to the machine. So the machine, what it's doing is the patient's, let's say over here, and normally these lines right here are hooked to your patient. You got your arterial and your venous. The arterial is sucking the dirty blood from the patient, and then it's going through a series of air detectors, and this is the filter where all the action's happening. The dirty blood goes into the filter right here, and it comes out on this side, and the special solution, the diacylate, is going on the outside of these fibers, and that's what's cleaning the blood, and the toxins all go down the drain, which is all the yellow clamps, which is the effluent. Red is for arterial, blue is for venous. So once it passes through the dialyzer, everything's going to be blue, going back towards the patient, where it goes through more air detectors, and the clean blood safely goes back to the patient. Hanging on the side right here is a warmer. This warmer is actually heating the diacylate fluid. It's not heating the patient, and it's not heating the blood. It's just heating the diacylate fluid so the patient doesn't get cold. And you always want the knob in the 12 o'clock position. You don't want it any more or any less. High noon. On the screen right here, we got a few different settings. The physician is going to be telling us how to program this machine. The dialysis nurses are going to program the top number, which is the DF4, which is the rate of clean for the patient. So the dialysis nurses are going to figure out what to set this number at, and that one's going to be set and that one's not going to change. The next one is the yellow. That is the ultrafiltration. That's how much fluid we're pulling off the patient. So if the patient is getting IV fluids, all fluids the patient's getting, we're going to add it up. And let's say it equals 100, and the doctor wants to pull at least 100 milliliters net, we're going to set this number to 200, because we're going to pull all the fluid the patient's getting back plus an extra 100. That way we'd have a net of 100. So this is the one that they're going to be going up and down on. Every time they give a piggyback, they're going to go up on it. When the piggyback's finished, they're going to go down on it. And we're going to discuss this number with the dialysis nurse. Before the dialysis nurse leaves, they're going to discuss that with the ICU nurse of what to keep it set at. Next one is red. It's going to be, this is the blood flow rate. This is just how fast we're taking the blood from the patient and returning it. And it's going at 200 mils a minute, which is fairly slow. It's just a nice, slow, continuous process. And this one is pretty much going to be set to, the nurses really shouldn't have to adjust it. The only time they would have to adjust it is if you had a really bad catheter and you couldn't get good flows. You can go down on it a little bit, maybe to 150. But for the most part, this one should stay at what the physician orders. The screen, there's a few different monitoring devices on the screen. The access, it just means arterial pressure is how hard we're sucking the blood from the patient. The venous is how hard we're pushing the blood back to the patient. The effluent is the waistline. That's everything with a yellow clamp. That's how much pressure is going through the tubing. And the balance chamber is in the cartridge right here. It's the pressure's inside the cartridge. Over here we have the therapy fluid, and it gives you an estimation of how much time you have left, like volume to be infused, just like on an IV. Next thing would be how much fluid we took off the patient, and then how long the cartridge has left. They last for 72 hours. So we have 62 hours left on this cartridge. Next thing we want to talk about is the bags. Oprah is going to talk about the bags.
So this is how your bags are going to look when you bring them to you, if they're in this plastic wrapper here. So this is out the wrapper here. The most important thing about the bags is that you pop this seal here. Very, very important that you have to pop the seal before you hang it, because one is acid, one is bicarbonate. So be sure and pop this seal before you spike any bags. So they'll look like this when we bring them to you, unless we have to bring them to pharmacy to mix, to alter the concentration. And then You know, they may or may not come back with a label on it or whatnot, but we will bring it. We take care of that on our end again, and we usually bring you enough bags for 24 hours, so you shouldn't have to, you know, ask us for any more bags within a 24-hour period. So this right now I have saline hanging just for, you know, just a, you know, just a teaching setup. But anyways, so your bag is gonna hang here. We usually hang 4, maybe 5 bags at a time. These bags are 5 liters. And to spike the bags, this is the spike here. Again, well, I'm gonna go ahead and pop it. So that's how it looks whenever it's popped. Again, be sure and pop your bags. So I'm just gonna spike it here just to show you. This is your little spike here. Just undo this plastic piece. I'm just gonna, no. Well, I won't. Yeah, I'm gonna get a new, I'm gonna get a new. And you have many spikes here. You don't have to use all of them. Like I said, we usually have 3 or 4 or 5 hanging at a time. So to spike it, be sure you spike it all the way up as far as you can against the metal here, and be sure and unclamp it. So again, we'll have, you know, 4 or 5 bags going to set your volume. So again, this is 5-liter bags. So each time you hang a bag, you want to set your volume up. So to do that, you go to this little button here, press that, and it'll bring you to this screen. As you see, we have 13.8, which we don't have that much, you know, hanging. But for a 5-liter bag, you would want to program 4 liters or maybe 4.5 tops, and it automatically goes back to your home screen. But again, to get to that, press that button, and you can alter it through the screen, you know, up or down on your volume. It's really important that you know, program a little bit less than 5 liters, because if you don't, you can suck air through the system, and that's a lot of trouble. So you probably end up having to reset up after that.
Probably on the topic of sucking air. So air prevention, good tip right here. So those bags that we just hung right here, they're room temperature. So they're gonna come down here and they're gonna get warmed by this warmer. And all these little bags in this bag, they have these little micro bubbles. It's kind of like fizz in a soda. That's basically what the bicarb is. And those little micro bubbles, over time, they're gonna get trapped right here in this warmer. So this thing right here needs to be purged. It's best to do it about 2 to 3 times per shift. You just come right here, you hook a syringe to it, open up your clamp, press on here, and you just aspirate with your syringe. Get as much air as you can out, clamp it, and then let go of it, and it's gonna suck new air right here. I mean, new fluid right here, and we'll get 90% of the air out. You won't be able to get 100% out, but this is about the most air, you know, you're gonna get out the bag. Because if you get air go down below this level right here, it will suck air, even though you didn't let the bags run dry. So just always purge your fluid warmer. All right.
So history.
So the history button, I know LGMC has a flow sheet that they like to fill out. Just hit your history button, and AP stands for arterial pressure, VP is venous pressure, EP is effluent pressure. That's your waistline. And you can get all your numbers from there. Your ultrafiltration will be in this column, and therapy fluid is those big bags up there. It'll give you a running total of all of your numbers you need to write down for your flow sheet. Another one is if you're having frequent alarms, go to the simple. It will basically tell you most, you know, how to troubleshoot the alarms, but there's a number right here you can get to, the 24-hour help hotline, and you can call that number, and the next stage people can walk you through any issues you're having. That's just an additional resource you have at your disposal.
So as far as some of the most frequent alarms you'll get is going to be the access pressure alarm. The access pressure alarm is going to usually be a negative number. We have these to our bag now, so it's not a negative number, but usually that's going to be a negative number. So if I were to say you have an access issues or your line's kinked or anything, I'm going to go ahead and kink it just to show you that it's going to go way up, and it's going to give you a red alarm, and that's going to stop your pump, stop your treatment. So to resolve that, you just hit mute. hit stop, and then when you're ready to restart, hit your green kidney button, and that restarts your treatment for you. And as far as CVC issues, you may have to, depending on where the CVC is, you may have to stop it and give it a good flush, or maybe move the patient here, maybe make them turn their head, lift or lower the leg if it's a femoral catheter. So that's probably the most common alarm you're going to get. Another one is either effluent pressure or balance chamber alarm, which is another red alarm. A lot of times that happens when your drain line is either kinked or your machine is parked on your drain line. The drain line will usually be running to the toilet or the sink. So sometimes the machine gets, parked over the line like that, and that'll give you the red alarm also.
So whenever your patient's not doing well, what are some options you have? Well, number one, you can always up the pressors. Of course, that's if they're on pressors and if the doctors want that. Another option is you can give them a bolus. You can give them a bolus of fluid through the dialysis machine. You can come here, and there's two clamps right here. There's a red one and a white one. And what that is, that's your double clamp on your saline. So if your patient's blood pressure is going down and you want to hurry and give them a bolus, just open up the red and open up this one right here, and it's gonna automatically start sucking fluid from your saline, and the blood pump's going at 200 mils a minute. So every minute they're gonna be getting 200 mils. So you probably can just leave it open for a minute. They would get 200 mil bolus, and you come back right here and you just clamp it. So that's one option if you needed to give a bolus. You always have to look and make sure you have enough saline though. So you don't want to give them because if you run out, it's going to suck air into the system. You just have to monitor that. Should have pretty much a half a bag though. After we finish the prime, you should have a good 500 cc's in there. Next thing, let's say your patient's crashing and you want to discontinue the CRT. We're going to go ahead. We're going to open up our saline just like we did on the to give them a bolus. Open both of them up, and you can go and find the big red clamp up here. Find the big red clamp. You can clamp it, and it's going to quit pulling blood from the patient, and it's going to just pull saline. So you can give your patient saline back. All your lines should turn kind of Kool-Aid colored. The saline is going to push all the blood back to the patient, and whenever your blue line that's on your patient becomes Kool-Aid colored, that's when you've gave all your patient back their blood. You can go ahead and hit stop on the CRT machine, clamp your big blue clamp, and then you can clamp the two clamps on the patient's catheter and just go ahead and flush them, and you can just push this machine to the side, and you can use their line for emergency medicines during a cold situation. And then if it's a planned, takeoff, so let's say the doctor says we're gonna end CRT at noon today. A planned takeoff, you can do it just like the emergency, but it's a little easier if you not having to do that. So a planned one would be you go up to the access where the patient is. This would be in the patient's, on their CVC. You clamp this one, clamp that one, flush it, bring this line and bring it back to this bag of saline right here. Because in a real world, this would be hooked to the patient. Bring it back to this red clamp right here, connect them, unclamp both of them, come back down, unclamp your saline, and then hit, it's probably going to be alarming at this point. So you just hit your mute, stop, and go, and reinfuse your patient that way, give their blood back. And then at the end, the same thing. Once they get Kool-Aid color on the blue side, go ahead and hit stop, clamp your blue side, and clamp your patient's CVC, and flush their catheter.
All right. So did we cover the yellow alarm?
No, go ahead.
Okay, so some of the alarms, you'll have a yellow alarm, the MIT alarm, the mute information treatment alarm. Yellow alarms are not going to stop your pump or stop your treatment. So an example of a yellow alarm would be if your CVC parameters or your pressures were getting either high in the parameters, and if you hit your access pressure here, it'll tell you the acceptable parameters for the venous and the arterial and the effluent. So maybe if your pressures were up in the 200s or 220s, it'll give you a yellow alarm, and it'll give you it'll get you to the screen to where you can push. What is it? The screen says what? Like it'll give you some options to resolve the yellow alarm. Some of the red alarms are like I talked about earlier, the CVC problems or the effluent pressures. That's going to stop your treatment. And again, once your alarm goes off, it'll bring you to the screen, and it'll give you a few options as far as resolving the alarms.
And to see if your pumps are running or not, these 3 green dots right here, see these green dots are lit, so that means that they are, they're running. But let's say you stop everything, you hit stop, see the lights, they no longer lit. So whenever you have a red alarm going on, it automatically stops them, and that's when you need to come and see what's going on, and try to quickly as you can diagnose the problem and get the blood spinning again. And as soon as you hit go, it's going to start off slowly with the blood, and then once the blood starts spinning fast and there's no alarms, then it'll slowly turn on your ultrafiltration and your therapy fluid, which is your cleaning rate.
So what else did we miss anything? Compressors. Oh yeah. Okay, go ahead. I'm sorry.
And the yellow alarm, see right here, is giving us a caution 8. What it is, it's more just like a safety program that the machine has built in. It likes to go slow, and it just checks to make sure nothing's going out the air. It's more on high alert. And then once everything's been running smoothly for a minute or two, and then it'll drop all the yellow alarms. And if you want to read any of the prompts it gives you from a yellow alarm and what's it doing, you can just click on the screen. This one's just saying we made some adjustments, so it's just going low and slow, and it's on high alert. And if there's no alarms in a few minutes, it's automatically going to go into the green operating mode. Another thing you can look at, it's more information, is the graft. So just click on it. Anytime they have an alarm or anything going on, that's what these big tall lines are. After your patient's been on smoothly for quite a few hours, it should look, more like this. If these lines start to kind of deviate, like some kind of start going up and some kind of start going down, that would be a sign of clotting. Your fibers in your dialyzer, it just couldn't filter anymore. So that's a sign of clotting, and it's time for us to come change the filter. The graft's another good way to get, you can still see all your pressures from the graft. The Simple is another resource you can find, solutions to alarms and minor problems. Along with the information button, you can kind of see, and it'll walk you through some of the common alarms, common treatments of hypotension, given fluid bolus. There's a lot of written information in there to kind of tell you and guide you along your way.
Yeah, so for the Simple, back to the Simple screen here, the setup, initiate prime, make connections, program treatment, launch treatment, that's all going to be us. That's all going to be us that set that up. So if anything you need the Simple for, it's going to be the end treatment. And it'll tell you plan return. You can click these buttons and it'll walk you step by step on the plan return. And Devin talked about that earlier. So that's mainly the part of the Simple that you will need. Let's see, Simple. Yeah, end treatment. And then it tells you the plan return or emergency return. So they'll walk you through the steps of it.
So just to recap, main things, the bags, always bust the seal on your bag, hang it, your bag, make sure you unclamp your bag after you hang it. And you want to make sure a few times a shift come right here, check on the amount of air in this little pocket for your fluid warmer. If need be, aspirate the air out with a syringe. This needs to be in the 12 o'clock position. The green and the red should be set by the dialysis nurse per MD order. And the yellow is what you're gonna go up and down on. So let's say your patient's blood pressure is, dropping, but not terribly. You can go down on this a little bit so you pull less fluid so you don't affect the pressure as much. But let's say the opposite of that. Let's say your patient's on CRT and they tolerate that well, and the doctor wants to pull more fluid. You can go up on that, and you can pull more fluid, per hour. And whenever you're doing this, it's in milliliters per hour. So if, going up from 100 to 200, you got to hold this button a little while. These buttons are hard to push. You got to make sure you really mash them. But going up and down on the UF, anytime you hang a piggyback or if you change the rail in your drips, you need to come back right here and also adjust this. So now if your patient was getting 100 cc's an hour and then you change your drips and now they're getting 90 cc's an hour, you need to come back and definitely adjust your drips. So bags, the warmer, we talked about the prescription right here. Troubleshooting the catheter is normally most of the issues, especially when they turn the patient or they come do x-rays or sedation vacations or the patient coughs. You're gonna have to reposition and flush your catheter if you get that negative 500 up here. And if y'all need more bags, definitely call the dialysis nurses. We always bring more bags than what we need, just to ensure, if anybody drops anything. And anything goes wrong, just always notify the doctors, of course, notify the nephrologist, what's going on with the patient.
All right.